There's now a sudden interest in brain aneurysms after Kim Kardashian revealed yesterday that she's been diagnosed with a small one. Aneurysms happen when a blood vessel in the brain bulges, but did you know they're actually, fairly common?
In fact, the American Heart Association estimates 3 to 5% of Americans have a brain aneurysm. So, of course, we had to bring in our 9 News medical expert, Dr. Payal Kohli, with more information. So, first and foremost, what is an aneurysm, and is it as common as we just learned?
In fact, it is. So we don't systematically screen people for aneurysms. They're generally discovered what we call incidentally. So you're getting a brain scan for some other reason, and they find this bulging. Now, brain aneurysms can be common, but you can actually have aneurysms or bulging any blood vessel anywhere in the body. The most common is our aorta, which is the biggest blood vessel that runs down our body. More common in women, more common after menopause. And so that's the reason we're really getting a lot of attention now, because Kim has raised awareness of this.
Is this something that grows over time, or is it sudden? I worked with a woman once who had one on the desk. She was healthy. A 50-year-old woman had one in her brain.
Oh my.
And it was just so sudden, and that's my knowledge of them. But is
So
it always the way?
She passed away?
No, she survived.
Okay.
She had surgery and the whole thing, but it was
Great.
just this crazy instantaneous thing.
Yeah, so think about it like a weakening of the blood vessel. So almost like a water balloon being stretched out over time. Now there's genetic factors that make the water balloon more susceptible, our blood vessels. There's hormonal factors, like in women. Inflammation can cause it, smoking, alcohol use. But really what we worry about, Alex, as you said, are the ones that grow over time. Because when they grow, they can rupture or pop, and that can usually be catastrophic, life-threatening, because it's a closed compartment. If it's not deadly, then it leaves you with a significant stroke, morbidity, or mortality as well. So we really have to try to catch them before they pop. Now, thankfully, 50 to 80% of them don't pop. They're usually just there.
So what happens then? So two-part question. One, should we all get screened? Two, if you do have one, do you have to continuously keep track of it just to prevent it from popping?
Yeah, so no, definitely we do not all need to get screened, even though they are very common, unless you have risk factors. So if you've had a family member, 2 family members for sure, but 1 family member plus other risk factors like high blood pressure, smoking, then you should get screened as well. But really you have to try to control lifestyle factors, high blood pressure, cholesterol, anything that can damage the blood vessel. Now, Kim had mentioned stress. Do you guys think stress contributes?
I would imagine inflammation.
Well,
right?
that's a terrifying thought. Who is a mother of 2 working
right,
like that,
Yes.
stressed all the time?
Definitely. So it releases cortisol, which can weaken the blood vessel. It can raise your blood pressure. So that is something we definitely have to work on, as well as in terms of controlling our stress. But for Kim in particular, I think it was discovered incidentally, although I'm speculating. I don't know how it was found. Sometimes the aneurysm gets so big that it pushes on a part of your brain that causes symptoms, like vision changes, like blurry vision. I don't know if that happened in this case, but you'll certainly need to have close monitoring to make sure that it stays stable. The rate of growth predicts the risk of rupture. The size of the aneurysm predicts the risk of rupture. The location in the brain predicts the risk of rupture, and then her other risk factors as well. So once she hits menopause, they might have to screen her more aggressively, potentially.
So if not surgery, you just watch it? There are other things, medication, anything else you can do?
Not really, unless you have high blood pressure, then the medication lowers your blood pressure. So I have some patients that have aneurysms in their aorta or their brain. I put them on medicine to rest the blood vessels so that there's less pressure inside the blood vessels. But if you're not having a coiling or a clipping, so for brain aneurysms, it doesn't have to be a big brain surgery. They can go in through the groin or go in through the neck, actually get to the brain and put a little coil or clip, kind of close it off. So if it's growing quickly, it's ballooning out, they think it's at risk for rupture, and there's a scoring system that tells them that, they'll go ahead and do that, then it's done. But if it's not, it's a little bit of a dagger hanging over your head, but you really want to watch it carefully. Get MRAs every year. What's
an MRA?
It's like an MRI, but looking at the blood vessels rather than looking at the tissue. And that way you can check to see how quickly it's growing. If it starts to grow quickly, that's when you'll want to coil it or operate on it.
I'm glad we know more about it. There you go, Dr. Payal Kohli. Thank you.